I'm Katie Hobbins, and we're here for Aesthetic Authority with Dr. Ava Shamban. Today, we're going to be talking about Aesthetics Biomedical's conference, The Evolution of Aesthetics. Dr. Shamban, thanks for talking with us today.
Oh, it's my pleasure. So nice to talk to you, Katie.
So I'd love to talk with you about the conference, specifically about your different panel discussions that you were involved in, one of those being the microneedling device and the differentiators. So I'd love to hear your thoughts on those.
Well, first of all, let me just start out by saying that it was really a unique conference for me to attend because it was experiential. So it was kind of like going to grammar school where you had like a show and tell, so that you could go and you could experience a lot of these procedures and products first, and then go into the lecture hall and hear about them. And I thought it was a very innovative and forward thinking way to design a conference. So I just wanted to start by saying that. So then, for example, for the Vivace, which is one of the premier microneedling radio frequency devices out there, that you could have a Vivace treatment and see what it felt like and see all the different settings that are available on the device and then go hear about it. So my thoughts about the Vivace device are that it's really, first in class for several reasons. One, it's FDA approved for all these uses, and a lot of the devices that are out there are not FDA approved for the way they're being used. And secondly, because of the microneedle array, and also because of the specialized engineering that's done with it, so that when you are using the device, it's not as user dependent. So that, in other words, the needles will penetrate to exactly the depth that they are programmed to, which is so important for results. And lastly, that the needles themselves, you can choose an insulated needle so that you're delivering heat at a deeper level, thereby avoiding a lot of the potential side effects of heat damage to the skin or post-inflammatory hyperpigmentation, and that you can really deliver, depending on the depth and how you're programming the device, you can deliver heat to exactly where you want it to go.
Yeah, well, that sounds definitely very informative. And it is interesting that you can see the device and experience the device before going into those talks and actually discussing the different features of it. Do you think that that's going to be a part of conferences moving forward, where it's kind of this two-part system?
Yeah, I was just reading this article about like what's going to come out, post pandemic. I mean, post the last pandemic 100 years ago, we got television. And so now I think that we're going to retool a lot of the ways that we're educated, so that, all the conferences will have have hybrid. You can see some online, be in person, but most importantly, that there will be an opportunity to have almost like a pod-like experience where you can try out the devices, try out the skincare, and then be able to hear more about it. Because inevitably, having the experience of the treatment will raise more questions for the person getting it, for the healthcare provider getting educated.
That definitely sounds like an innovative way to discuss the new technologies. And I hope to see that in the future, especially as a journalist going into those conferences. So you were also in two different other panel discussions, one on combination therapies and the other about let me just check my notes, about how to strengthen the aesthetic practice through social media partnerships and campaigns. So I'd love to know a little bit more about your experience in those panel discussions, anything that you think should be brought to the forefront.
Well, I think it's really important to understand how advanced healthcare providers, physicians, nurse practitioners, how we utilize combination approach to get our best result. So for example, if we're doing device assisted drug delivery, so that means that if you're using the Vivace, obviously you're creating tiny little channels in the skin. And then in those channels, you can use that opportunity to do a deeper delivery of your skincare, but that the skincare needs to be specifically designed to use in combination with those devices. So for example, the SkinCeuticals CE and Ferulic is paired with Vivace, and it's known to be safe and effective. So that's one, pairing a topical either laser assisted delivery or microneedling assisted drug delivery. And then the second is being able to layer different devices at the same time, knowing that it's safe and efficacious for the skin. So we all like to combine treatments, and it used to be like, okay, you got to wait a month, you got to wait a month. But it turns out that a lot of things you can layer. And I think that's something that we discussed in length on the panel, like what can you layer with time, efficiency, and also even a synergistic effect of the layering, that you get a better result if doing two things at the same time rather than spreading them out.
Could you give me an example of those combinations with the microneedling device that have been found to be really effective with other devices or treatments?
Yeah, so for example, sometimes the microneedling you want to do over the whole face and neck, but around the eyes, you may want to address crepiness of the under eye or up even upper lid area. So there's a device that was also present at this meeting called the plasma pen. And so the plasma pen will give more of a resurfacing tissue tight, you get tissue tight with Vivace, but for this skin here, it's you really could use the plasma pen to get a bigger result. So that's one example. And the other example is how we like to pair the procedure, like the Vivace procedure, with an at-home skincare that's going to really enhance the results. And so, for example, they had the SoMe skincare there, which is basically it's PRP. So that's where you draw the blood, take the platelets out that have all the goody growth factors in them, and then you can apply. So we also apply PRP on top of freshly microneedled skin, but it's also they have a unique delivery system with a skincare that, and people were having this done at the meeting. They were having their blood drawn, their platelets spun out, and then mixing it into the skincare that has been shown to be that you still get the efficacy over time. So we pair that. And then sometimes there was a peel there also. Sometimes we'll do microneedling and then we'll peel the arms. We like to address everything that you see. We don't want to have the face, the skin on the face look one decade and then the skin everywhere else look completely different.
Of course, of course. With the other panel that you were a part of about the social media partnerships, what did you learn from that conference? Is there anything that you're going to implement personally? Is there anything that you brought up that you found has been really successful in your opinion?
Yes, I think that we all understand now that, well, there's two things with social media, which is that social media provides people with an introduction to your practice and to you as a doctor or a nurse practitioner or a physician's assistant. It provides this introduction that you can have before you get to the office. And I think that's really important so that you can get to know everybody's philosophy about beauty and also their expertise into what kind of procedures you're interested in doing. So it's an educational experience and also a bonding experience, if you will. So social media, you have to be on social media now, I think, because we're in the person to person, you want to have the relationship. So that was educational. And then I think for me, having my brand, Ava MD, and I have a new subscription box called The Box by Dr. Ava. And so what I learned was that you can also work in a different way with an influencer. And so they had a lovely young woman who'd been on The Bachelor, and she was the one that married the guy, and they were both there. And I learned about that. And also I learned about that we talked a little bit about having a brand strategist. And so these are some takeaways for me, and also I think for the audience as well.
I would say so. And especially coming out with new social media platforms. I know that Derm Talk is definitely something that's growing. Do you find that you're seeing a lot of your colleagues hop on TikTok and getting big followings and really being able to discuss some topics that usually would be patient to physician conversations, but with a broader audience?
Yeah, for sure. I mean, it's so interesting to me how TikTok is sort of like overtaking everything. I mean, we started with tweets and Facebook where it was just writing, but people like to watch a movie. They like to see pictures. So then you get Instagram, and YouTube. So you start being able to communicate, like before there was the written word, we told things like with, charades. And so then you throw in a little music. And so we're hardwired to like music. I was trying to figure out what was so popular about it. Well, what do we like better than to watch something and learn about something while we're listening to a great tune? Speaks to our minds on so many levels. So yeah, I mean, TikTok's here to stay for sure. And you can have a lot of fun with it. It's kind of like using a hashtag because you can make a comment on what you've said without, in a subtle way. So you can use a song to express something else. So it adds another layer. So yeah, TikTok is here to stay. And yeah, a lot of dermatologists are doing it, some tastefully and others not so tastefully. So I'm in the tasteful, like, let's have a good time and let's learn something while we're doing it.
Going back to the conference, this was a smaller, more intimate conference. Do you think that we're going to be seeing more of those because of COVID restrictions, even after COVID is done, hopefully sooner than later, that the smaller conferences are going to be more popular because they're more intimate and more of a discussion than presentation?
I think there's not a single doctor I know who wants to go back and sit in an enormous lecture hall and hear a talk from somebody who's like so far away on the stage. None of us want to see a return to that. I mean, from my opinion, I think as more of these events come up where they're smaller, it's more intimate, you really learn about the product, you really then can ask questions from the experts about the technology. I think they are the future. I really do. And this was an aesthetics biomedical just was genius. I mean, it was so forward thinking. It worked for being careful about COVID, and it worked on just so many levels.
Well, definitely with the vaccines and everything, hopefully I'll be able to start going to these conferences again and see firsthand the innovativeness of these smaller, more forward-thinking conferences. I did want to thank you for talking with me today, Dr. Shaman. I know you're very busy, so I'll let you get back to your day. But thank you for discussing the conference with me and your ideas and opinions on the different panels that you were on.
My pleasure. Thank you, Katie.